Hello, this is Jonathan Kay from the University of Massachusetts Medical School reporting for RheumNow at EULAR 2021. It has been yet another interesting day of presentations that should have been given in person in Paris, but instead have been delivered virtually over the internet. Two cohort studies examining aspects of mental health in patients with rheumatoid arthritis were presented today. Dementia, especially that in Alzheimer's disease, has been associated with cerebral inflammation. Does a systemic inflammatory disease such as rheumatoid arthritis affect cognitive function? Well, in abstract OP0216, Kronzer and colleagues from the Mayo Clinic assessed the incidence of dementia over time. A cohort of nearly 900 Olmsted County, Minnesota residents with incident rheumatoid arthritis between 1980 and 2009 and compared them to contemporary age and sex-matched controls. They found a significantly higher risk of dementia among patients with rheumatoid arthritis that had been diagnosed in the 1980s and 1990s compared to controls. However, the risk of dementia in those who had been diagnosed with rheumatoid arthritis between 2000 and 2009 was no different from that of contemporary controls without rheumatoid arthritis. Notably, the 10-year cumulative incidence of dementia in rheumatoid arthritis patients declined substantially from 9.3% among those with disease onset in the 1980s to 7.1% among those with disease onset in the 2000s. This reduction coincided with the introduction of biologic DMARDs to treat rheumatoid arthritis, generating the hypothesis that effective anti-inflammatory therapy may have contributed to this substantial decline. Does the presence or absence of rheumatoid factor impact mental health or sleep in patients with rheumatoid arthritis? To address this question, Stanciu et al. Used data from the UK Biobank cohort of nearly 6,000 people who self-reported having rheumatoid arthritis to determine whether the presence of rheumatoid factor was associated with mental health, cognition, or sleep. In an unadjusted regression analysis presented in abstract OP0215, they found that neuroticism, sleep duration, napping during the day, and reaction time were significantly associated with the presence of rheumatoid factor. However, after adjusting for covariates of age, sex, ethnicity, deprivation index, smoking status, body mass index, and alcohol intake, only sleep duration remained significant. A limitation of this study was its reliance on self-reporting to establish the diagnosis of rheumatoid arthritis. However, it'll be interesting to see whether these findings are confirmed in a cohort of patients with the diagnosis of rheumatoid arthritis that has been confirmed by a healthcare professional. Much other interesting information has been presented today. For more EULAR 2021 coverage, head to rheumnow.com. I'm Jonathan Kay.